Hi, Professor Welch and my classmates for Infographics Fall 2022. I am happy to share this presentation with you. I was very interested in the data about Washington, D.C., a city that I was born in and lived there for the last 8 to 10 years before moving, just before COVID hit. So I was really interested in what happened in DC and how the residents of DC were affected by COVID. I moved to the West Coast just before it happened, so I missed it pretty much. I heard bits and pieces, and my goddaughter lives there and friends, and so I would hear things. But I really wanted to look into the data of how DC was affected by COVID. And when I started delving into COVID data, I know there's a lot of it. I've been watching it probably like a lot of other people during the pandemic, and the New York Times is a great resource. But it turns out different cities have really amazing data systems, and they have a lot of data available about their population. So I started out looking for health outcomes in DC by zip code. And if you'll notice, the perimeter around DC, it's a bit of a red diamond shape. And on the bottom left side, it's delineated by the Potomac River. And you can just draw a straight line north, and that is the barrier between east and west. And so where you see the Washington National Cathedral, that area is called Northwest, and it's pretty affluent. There's lots of hospitals, restaurants. It's quite nice. Mansions. It's where amazing homes are and a lot of wealth. And then opposite of that, where you see places like Oxon Hill, Temple Hills, Capitol Heights, and that's the Anacostia River that runs there, dividing that part of DC. That's called Southeast, and that generally has more crime, more poverty, and less of everything, less resources, less hospitals, and I'm just going to continue through the slides because I'm going to let the data tell the story. So what I knew going into it is that DC is already a city divided. And even their license plates say taxation without representation. DC has been trying to become a state for a long time. Unfortunately, it never has happened. Federal jurisdiction overrides local votes. It's done this during the time that I lived there, and I think throughout history. There's extreme wealth and extreme poverty on display in DC. And there's a long history of a Black population, and even a majority Black population for a very long time. And right now it's slightly under majority, but it's just about half. So, with all of that in mind, knowing that DC was already a city divided, and wanting to look at the data and around COVID and what was going on there, I made this chart for some comic relief because it's really horrible what was going on there. And I asked how I would rank my stress level. That's what I'm gauging here, as the events of the past few years unfolded. News networks report viewership during COVID had increased vastly. And with the political climate in post-Obama years since the 2016 election, and then the increase of witness police murders, and then COVID and the pandemic, there was a feeling of escalation happening. So those are the numbers I added on the left column to represent my stress level. But really, election day of 2016 was already pretty heightened. I just gave it a 3 because it was going to get worse. And as I was comparing data from Northwest, the affluent area of Washington, or one of, and Southeast, a few things became really apparent, and that was that education and median income are tied together. There's so many other data points available through the DC government website, but I was really looking at data that could increase somebody's chances at having a good life. And wealth is one of them, and education can lead to wealth, or at least a good living, if not wealth. So There was a lot of documentation I found about food accessibility. You know, we're talking about quality of life. You know, Southeast is defined as a food desert. Two of the keys of a better life would be more education and more money. But for those who are already in poverty, it's really hard to get out of it. When you're embedded in this disparity, when you don't own a car, when you take public transportation, it takes a lot more time than driving, for example, to be close to work or food. It's a labor in itself just to get around. Another effect of living in an area without access to good food, there are pre-existing conditions that come with a poor diet. They're the effect of a poor diet. They're also known as comorbidities. And one of the reasons I chose to focus on DC, other than loving the place, is that everything is incredibly well documented. So what I learned is that 32% of DC residents have pre-existing conditions. That's 228,000 plus people who suffer from obesity, kidney disease, COPD, heart disease, and diabetes. And these were the people that were most affected by COVID when it first hit, in addition to the elderly and people that were in service industries and exposed. And I found this amazing website so that I could actually start to see by the breakdown. And this is, I believe this is by zip code, but it shows the whole region of Washington, DC. Again, you see that diamond shape, and you can see Northwest doesn't have a lot of kidney disease, but when you get to Southeast, it's pretty dense. So as I saw more data, I continued to see the story unfold between the correlations between health and location. So here's kidney disease, here's diabetes, and COPD, heart disease, and obesity. And the surrounding area where the darker colors continue is Maryland, and that's Prince George's County, that is also predominantly Black and not as affluent as the suburbs of Washington in the other direction, like Bethesda, which you can see on the map, or over into Virginia, like McLean is very well-to-do. And then there were the headlines that I was encountering. This one was the most shocking of all, and the first article I read wasn't well written, and I thought to myself, this can't be true. This is really poorly written. This can't be true. And it wasn't adding up with other data I was finding. But the more I dug into it, I realized that this data was from a specific time period. So as of October 20th of 21, when this article was printed, I believe they're all within a couple days, the 20th and the 21st. This was the data coming out of the DC government. So this was accurate as of I think the period was June to October of 21, that 49 out of the 50 people who died of COVID in DC were Black. When it came to images and storytelling, I kept thinking back to this exhibit I had seen at the DC Holocaust Museum. It's this massive pile of shoes of those collected from concentration camps, shoes that belong to people who were killed. And, you know, it's one of those images that just sticks with you when you see it. And I remembered it, and here it is. And I let that serve as inspiration for the graphics that I wanted to come up with to tell a story. And why I wanted graphic images primarily is for the demographic. You know, I want these types of images available on public transportation, whether it's buses or trains. You know, it's the people that are affected who ride buses and trains, and I wanted a bright color scheme, something really easy to digest: black, white, red, white, and blue, in honor of Washington, DC. And I wanted the information available. You know, people on public transportation don't have a lot of time to read. And maybe given what data tells us about education levels, charts might be too much to digest or intimidating. So I wanted easily accessible images to convey the story. And again, this was just such a shocking headline that it really was motivational in the storytelling. And, fast forward, a lot of people in DC, in fact, the majority have gotten vaccines. So numbers have shifted, and now it's about 75% of the people dying of COVID are Black, down from the 49 out of 50. That was between June and October of 2021. And while numbers have shifted, it's still unacceptable. And there has been a lot of outreach from DC for bringing food into underserved areas and education around the vaccine. And I made this graphic, and I really like it. It's kind of like a movie poster, just bright. And I left it blank because the numbers are always changing. So if it ever becomes anything, I'll put some actual numbers in there. But we know from data where it's going and where it is currently. So maybe in the future, the numbers will be a little more promising. And just as an example that this is a live subject, it's very much alive. And this slide is from November 16th of 22. Here's our Surgeon General at the White House Summit on COVID-19 equity. Here is a tweet from former presidential candidate Marianne Williamson speaking to the subject. And here is a release of a new book, Under the Skin. I think it was one of the year's greatest books. It's on a lot of lists. I have not read it, but just to share that this is a subject a lot of people are talking about and thinking about. Thanks for staying with me for the presentation. Take care, everybody.